Welcome to Sex with Rebecca, a show geared towards relationships and sexuality that will help you enjoy your relationships more than you ever thought possible. Send us your difficult questions and we'll bring you expert answers unlike anywhere else. Whether you're looking for more passion or connection, kink or better self-expression, we got you covered. I'd like to begin this segment by answering an email we received. Dear Rebecca, my husband has stopped connecting with me and is doing everything in his power to push me away. Furthermore, he suddenly found the need to password protect his electronics, which are now attached at the hip. When I confronted him about his demeanor and changes in habits, he snapped at me and told me that I was imagining things. I can't even talk to him about any of it now without him making me feel like I'm crazy. Could it truly be just in my head? Signed, Monique. Monique, if this is a temporary thing that's tied into a work deadline, then you have to cut him some slack. But if it's becoming an ongoing thing without any rhyme or reason, then you have every right to be upset. The official term for what could be happening is gaslighting, based on a 1944 film Gaslight, starring Ingrid Bergman. Bergman's on-screen husband wants to make her think she's insane, so he can haul her to mental institution and he'll be able to get his hands on her jewelry. So he intentionally sets the gas lights in their home to flicker on and off, and every time she reacts to it, he tells her she's just seeing things. Monique, while in that situation the gaslighter was someone presenting false information, the term is generally used nowadays to refer to intentional attempts to drive someone crazy by telling them that they're too sensitive, emotional, dramatic, irrational, overreacting, freaking out for no reason, acting stupid, imagining things, etc., etc., etc. Remarks that use emotional manipulation to shut one down. FYI, whether gaslighting is conscious or not, it produces the same result. It renders many people emotionally mute. They end up dismissing themselves as unimportant and back off, which is what the gaslighter wants. So what can you do about it? Remain authentic, believe in yourself when your emotions feel legitimate, and no one else seems to think that you're over-the-top reactive. And most important of all, Monique, stand up for yourself. To our audience, if you have any questions of your own, do write us, especially if it's around something that's challenging your intimate connection. Speaking of intimacy challenges, tonight I have a very special guest for you who will answer some critical questions in that area. Dr. Frank Sommers, recipient of the OPA 2017 Psychiatrist of the Year Award, who's been a guru to us all when it comes to sexual matters. Welcome, Dr. Sommers. We're so very delighted to have you joining us today.
Pleasure to be here.
Very excited. Why don't we get right into it by discussing some common maladies that our clients suffer from, starting with erectile dysfunction. Definition, etiology, treatment, everything.
Very common problem. And that's first thing that men should know, and their partners as well. But especially single men who don't have partners and who are afraid to get into relationships because they have erectile issues. This is a fixable problem. Okay, so that's a very important point to establish.
Music to my ears.
It's usually not necessarily fixable with a pill, with an expensive pill, which I call a sex tax, by the way. Usually sex therapists are very well equipped to deal with this problem, and men, when they feel they're having an erectile dysfunction, should really talk to their GP, especially after a certain age, let's say mid-40s, because it could be a harbinger of some more serious problems, for example, creeping up heart disease. Sometimes that's the
cardiovascular
first,
stuff.
That's correct, yes.
And that's the only area where the expensive little pill may in fact help, not always, but a lot of the other areas, you're right, it's talking to a sex therapist.
Well, and a proper course of treatment for that is very much a possibility, and the results are usually excellent. So
and you'll be talking about that in a little bit.
Certainly.
Let's move to another common one, premature ejaculation. Again, definition, etiology, etc.
So the term that actually I use these days is rapid ejaculation, because if there is a premature ejaculation, what's a mature ejaculation, right?
Right, and also it's a matter of opinion, and it's all relative.
Right, exactly. So in academic sexology, you know, we do have experiments where people actually time themselves with a stopwatch and stuff like that. But really, rapid ejaculation is basically when you're not happy about your inability to control when you come, and your partner is unhappy. And of course, this is a fairly common problem. But once again, the treatment for this is available. It doesn't involve medications. And I want to say here that some of our doctors are unfortunately not trained this area. So they prescribe an off-label use of a psychoactive compound, which usually can also play all kinds of tricks with your brain. So I do not prescribe it. I do not recommend it. And if we had more better trained sex therapists, then we would know that there is a very useful and workable problem for this. The cure rate for rapid ejaculation is close to 100% without the use of medication.
That's excellent. Now, we're talking about it being relative. What happens if you're faced with a couple where one party thinks it's rapid and the other does not? Often a male might think that, I took my time, everything's okay, and the female may have a notion of going much longer. What do you advise couples in that situation?
It really depends on how profoundly that problem is impacting on that particular individual. And I have a couple I'm treating currently, for example, in this situation. And then the wife says she's fairly content with the sexual life, even though the husband is fairly quick.
He's not happy with it.
But he is not happy with it. He knows that she's not happy with it, even though she doesn't complain. She wants to be a supportive partner. But he really feels that he's not really, in his case, he sort of feels like he's not fully a man because he doesn't have a better control.
So emotionally, it's impacting.
Right.
I want to touch on delayed ejaculation as well, but we got to pay some bills. We covered lots of great physiological challenges and what to do with them. When we return, we'll be discussing the mind-body connection in creating and fixing sexual challenges. So don't go anywhere. Welcome back to Sex with Rebecca, geared towards making your relationships more robust than you ever thought possible. In this episode, we're talking about various sexual challenges with an esteemed guest, Dr. Frank Sommers, a renowned psychiatrist who's been healing sexual issues for decades. Dr. Sommers, some of the challenges that we discussed can actually be related to our sexual habits. So let's go there next, starting with penile challenges that result from porn and or certain modes of masturbation.
So before we do that, may I just jump back to talk for a word or two about delayed ejaculation, which is the opposite of coming too fast. And this is quite a challenge for many men. And they also have to realize that it's a problem that is treatable with traditional sex therapy. And the outcomes can be quite good. It is a challenging problem, but it is fixable. That's the important message. So with respect to porn, you want to talk a little bit about that?
Yes, but thank you so much for mentioning that, because a lot of people don't know that delayed ejaculation is a thing. We know about ED and PE, so I'm glad you took the time. Now, how does porn impact and or masturbation impact? Because I know some people, they can see erectile challenges related to that. So maybe you can quickly comment on that next.
Right. This has become a major problem. And because my practice spans the pre-internet era and the post-internet era, I have a very good comparison between those two. And clearly, after the wide availability of internet and its easily accessed by many people, many of our youngsters, starting at age puberty, boys especially, start their sex education from watching explicit porn, often alone in the bedroom with their laptop. And this results in several thousand ejaculatory experiences for them with that kind of powerful stimulation. So now we have a situation where when they get into finally, years later, in a real situation with a real live human being who they care about, they can't function. Notice I don't say perform, because sex is not a performance. They cannot function. And that is a major issue these days. So the issue of watching porn excessively and getting that kind of stimulation, that kind of dopamine drives in the brain, cannot be reproduced with a real life partner frequently. And they then get into a kind of a rut where they cannot function, and then that becomes a self-fulfilling, self-reinforcing situation. And these young men, often younger age than we used to see before with erectile dysfunction problems, need to realize that there is a biological impact on their brain of the use of this kind of porn. The other satellite issue to this is if a man decides that he's going to stimulate himself as a particular way, which is particularly strong, for example, rubbing against sheets, he may well find it difficult then to get enough stimulation from being inside
any
a
kind of
vagina.
penetrative
Exactly.
sex.
So that is another issue that conditions the body and the nervous system, which can be helped, but men have to realize that there's a downside to excessive porn use.
And when they are self-stimulating, they're at the giving and the receiving end, so it's very difficult for the partner to replicate that. So I think it's important for partners to know that this is a change that's happened in the male, because a lot of times, I'm sure you see that, but I see that as well, where the female partner is devastated. She says he can get himself off with the images of others, but he can't do that with me. Now, another place where, speaking of getting off, maybe we can discuss anorgasmia next. Can you please define that and talk a little bit about what that is and how it can be treated?
Right. So we have to recognize there is a real biological difference between female sexual arousal patterns and male sexual patterns. I usually show my patients a graph. So the male pattern is fairly steep. The female pattern is more like this. So it's almost like a woman is climbing a hill, and the man may already have reached a peak. And many women get stuck at what we call the plateau phase.
Right.
The payoff for women is, if they can peak, is that they can stay up there longer. They can have multiple orgasmic peaks. The problem is that for many women, they will not get enough mental stimulation and physical stimulation combined from their partner that will enable them to reach that peak. And this is, again, trainable, but women need to know how their body functions. They need to realize that most of their sexual stimulation will come from the brain, not from testosterone, as it is from men. And therefore, it is a body-mind connection problem, which is challenging. But again, the good news is that it's trainable with goodwill.
Absolutely. I'm so glad you mentioned that, because a lot of females, they think that something's wrong with me, and sometimes they don't even learn how to get themselves off, and it's unfair to expect their partner to take them to a place when they themselves don't know their body. So I always say an orgasm is not given, it's taken. So it's not, my partner doesn't give me an orgasm.
Exactly.
Real quick, if you can, maybe in 30 seconds or less, talk about when sex is painful for a female.
Right. So the term for that is vaginismus. Anybody can look it up on the internet. And that is also far more common than we used to think. But it's an involuntary spasm of the vaginal muscle, or actually the pubococcygeal muscle, which forms the pelvic floor. And it encircles the anus, the vagina, and the urethra. So it's very important for women to learn to practice with that muscle. The Kegel exercises are a good example of that. But if they develop an involuntary spasm, then it's very important for their partner to know that they should stop trying to press through that. That will not work. It will cause additional pain and discomfort.
A lot of pain.
Good news is, this too is trainable. There's a treatment program we have for treating vaginismus, and women who have this kind of pain. There are other kinds of pain as well, which I haven't yet mentioned, but there are other kinds. This kind of problem is treatable.
And that's why I'm so glad that you're joining us today, giving us all these remedies. And of course, when we're talking about vaginismus or dyspareunia in general, it's important to mention that sometimes it is the result of early sexual abuse. So we have to be respectful of that, and that, of course, requires a different kind of treatment.
Absolutely.
And you've got lots of stuff, so we're going to be talking about that. Speaking of remedies, when we return, we'll be discussing Dr. Sommers' highly effective mindfulness approach and his remarkable book on changing your brain to change your sexuality. I know you'll want to stick around for that. Welcome back to Sex with Rebecca, a show where we bring you expert advice on important matters to help your relationships be more intimate, exciting, and emotionally fulfilling. We've been talking about handling sexual challenges with a renowned psychiatrist and sexual healer, Dr. Frank Sommers. Dr. Sommers has written a remarkable book, Lose Weight, Stop Stress, and Make Better Love, which is aligned with what we're discussing tonight. So I'd love for us to chat a little bit about it. Dr. Sommers, can you give us an abridged, like sort of a Reader's Digest version of what this book is all about?
Sure. So basically, I had an opportunity to help our soldiers in Afghanistan 10 years ago. And over there, I wanted to find a way to help our soldiers with very strong stressful situations, as you can imagine, life and
Absolutely.
death situations, without having to give them medication, which may affect their ability to function.
Right.
So that's why I put together this 5-step program, which I've been teaching to my patients in different formats. But since coming back, I've now put this out in a little book form, which is very easy to read. People can read it in an hour, very simple. But it's a 5-step program which is based on modern brain science. And it is a possibility for every person to learn that and to practice that, and essentially give them the tools using part of their brain to use another part of the brain, especially when it comes to addictive behaviors or stressful behaviors, and of course stress and various kinds of other problems, relationship issues, have a huge impact on sexual life. And in that book, I mentioned a few episodes of that where people have had functioning difficulties. But using the 5 steps is now a core part of my approach to helping people with sexual problems.
I was reading an article by you, and you're talking about addressing some pretty critical issues, myriad issues that have to do with sexuality. Can you quickly tell us what those 5 steps are?
So the basic idea here is that we learn to train our nervous system, and the basic approach is mindfulness, which I've started practicing 40 plus years ago. And my terms
And now everyone's catching on.
I'm so glad to see that, actually. But my terms for that is being present, centered, and process absorbed. So here we are learning in the first step how to do that, how to get into the present, centered, process absorbed mode. Step 1 is to check our senses, our 5 senses. What do I see, hear, touch, taste, smell? That enables me to get away from the thinking brain and get into the sensory brain. Second is some deep breathing, 1 or 2 slow, deep breaths, because when we're stressed, we tend to be slow breathers.
Right.
Third step is stopping negative thoughts. And I call them dark alley thoughts, because thoughts have consequences.
Right.
We all have to recognize that thoughts have certain benefits, but others can pull us down and it can be toxic.
Go there in those areas, those fearful areas, particularly when there's sexual issues.
Absolutely. And rumination can lead to depression.
Yes.
And then the 4th step is positive self-talk. And this has to be rooted in reality. And it enables us to resource our inner strengths, where we remind ourselves of challenges we have overcome. And usually it's most useful when it's crunch time, when we feel our back is against the wall. And then the 5th step is being able to conjure up in your mind's eye a soothing, relaxing image. So these 5 steps now are in a format where people can put it on their smartphone or they can put it in their wallet. And if they adopt them, I've seen this with soldiers who have come back from the front lines and told me how valuable this was for them.
Stress, yeah.
And when patients that I've used it now with many patients since coming back from Afghanistan, and the 5 steps.
As an application to sexual.
Absolutely, it's a brain changing, and because it'll help people in their sexual life in the bedroom, because we only have one nervous system, and this is based on remodeling how we work with the brain and the autonomic nervous system, especially. Stress from any source will be able to be handled much better.
Much better. And I like that you engage the senses, because even though we think we have free will, our subconscious has a lot to do with what happens, and that basically you speak to it through the senses. So I'm really glad that you have the sensory work in there. What else can our viewers pick up from this book? So they have the 5 steps and the application. What else can they
Well, I also have a section in the book about a major problem in our society where over half of our population, certainly in North America, is either obese or overweight. So in this book, it's not a diet book, because I think most of us know what we should be eating and what we shouldn't be eating.
We have a pretty good idea, yes.
Right, but it's more like, how do we exert control over what we put into our mouths? And that is something we can learn to control much better. Because so often we eat not because we're hungry, but because we are dealing with other stressful situations, or
emotional eating, so to speak.
Exactly.
Yes.
So eating becomes a substitute. And I call it the number 1 tranquilizer in our society.
Absolutely.
So the weight section, which comes after the stress section, the 5 steps enable us to be much more mindful, much more aware about the food choices that we made and what we put into our mouths. And that is empowering, and it gives us control. It won't lead to very rapid weight loss, but if we consciously adapt this and use it, then the results will be actually following. So these 5 steps help us in stress, in our weight issues, number one public health problem perhaps, and in sexuality.
And the first two very much feed into the third, because when you're stressed out, I mean, that impacts sexuality in a big way. And also weight-related issues, some of them are physiological and some of them are psychological, where people don't feel good about themselves. And ultimately, both of those play out in sex as well. Do you have any couple of real quick tips for couples to kind of have the conversation? So I guess picking up the book is a good way of doing it, but to have the conversation to say, we need to change. We need to give ourselves the permission to change how we look at sexuality, and just give ourselves the space to redefine sexuality. Do you have a quick comment on that?
Well, I think in terms of my little book, which is easily accessed now on Amazon, people can read it together and talk about it with each other. And that is a wonderful first aid step to getting those tools to enable you to manage your brain much better. What we didn't talk about is the issue of couples communication.
We'll come right back to
But
it.
that
Hold
is a
on to
very
that
hot
thought. It
subject.
is very important. Coming up, some final words on enhancing intimacy and, of course, communication, and moving past the sexual challenges that we've been discussing. So do stick around for that. Welcome back to Sex with Rebecca, a show geared towards making your relationships the best they can be, both in and out of the bedroom. We've been discussing various sexual challenges with Dr. Frank Sommers. Now, before we wrap up, first of all, you had a comment to make on communication. Why don't we go there? And then we can talk about some key points that you want to hit.
Right. Communication, of course, in any relationship is very important. And whether it's between parents and children or between partners in life. It's probably the most important skill, which I find most people lack. People don't seem to recognize that just because they know how to talk, that doesn't mean they know how to really communicate. And a relationship is going to flounder unless we learn communication skills. There is an art and a science behind this, well established. So we need to learn and teach people how to do this. We should be teaching it in schools already, actually. So
we certainly teach it with our clients. I do.
Absolutely.
I teach mine, and I'm sure you teach yours as well, because it can make a huge difference in how the ebb and flow of the relationship, and to keep misunderstandings at bay.
Absolutely. Feelings of frustration, irritation, annoyance, and anger will arise in every relationship, no matter how good the relationship is. And if you don't deal with it regularly, it'll become what I call a swamp of resentment. And once people are stuck in that swamp of resentment, they won't be able to move. They'll feel at an impasse. And many of our listeners, I suspect, are in that boat. They're caught in a swamp of resentment. And this is where you may need a professional coach or therapist to help you get out of that. Once you get out of that, then you can move forward. But there is a skill set that needs to be learned by all of us. And unfortunately, most of us don't learn this in our growing up years from our own parents.
So it is important to, of course, address that.
Absolutely.
And again, everything else sort of hinges on it. And we see couples, once they do that, they can start to move forward. Real quick, if you can tell us, how can someone know if an erectile difficulty is physiological versus psychological? Obviously, if they go to a professional, they'll help them. But real quick, the person at home, how can they know it's one or the other? Because they all seem to rush for the blue pill. That's just there for cardiovascular stuff. Quick comment on that.
Well, first of all, if you're able to have erections, if you wake up with erections, every man has erections every time they have dream sleep, so-called REM sleep, which is about every 90 minutes during. It doesn't matter what the sleep is about, men have erections.
And the morning would, too.
The morning erections also happen, depends on where you are in your sleep cycle when you're waking up. Now, if you're able to have those erections, then generally you do not have a physiological problem. You may have still a physiological control problem, because I call sexual problems mind, body, or psychophysiological problems, not one or the other. But if you have a true physiological issue, such as arteriosclerosis, or perhaps some nerve damage from diabetes, then generally you will not be getting spontaneous erections, and you will also have more difficulty giving yourself an erection. So that's the take-home message, that if you're able to give yourself an erection and or waking up with erections either during the night or in the morning, the chances are that that is not a physiological issue, and it's probably the kind of issue that sex therapists can quite readily deal with.
And like you said, that a lot of stuff is physiological as well as psychological in nature, and that's why your approach takes the mind, body, soul into
Absolutely.
consideration for
That's
that mind, body, and soul connection. Boy, time goes by so quickly. Dr. Sommers, thank you so much for joining us today. You've given us lots of really important things to think about, and you've given us some solutions and introduced us to your 5 steps. We really, really appreciate that. Thank you, Dr. Sommers, for all your remarkable insights, and viewers for joining us. Be sure to tune in again next week. And don't forget to email us your questions and subscribe to our YouTube channel to catch up on missed episodes, watch your favorite shows again, and to help us pass on the word. Let's create a sexual revival in Canada. I'm Rebecca Rosenblat, your host, wishing you happy, healthy, and passionate relationships. Until next time.
The kids were jumping on the bed again.
Visit aren'twenaughty.com.
You'd be more likely to lose weight if you could afford a professional weight loss program. If you have over 20 pounds to lose, you could qualify for a weight loss grant up to $2,000. There's no cost to apply and no risk. Go to weightlossgrants.org